Okay, we've only got half an hour, and I do want to be respectful of everyone's time, so we'll just go ahead and get started. So thank you for joining us on this webinar, just to give a quick sense of where we are and where we're trying to go, and ask for your help in getting us there. So next slide, Daryl. So I think if you're on the call, you know what the Protecting Immigrant Families campaign is. But just highlighting that we do have partners in at least 40 states, and are happy if you're not already connected to the other parts of the campaign to add new people in and build state level connections, because that's really important for this work. Next slide. So in this webinar, I'll be joined by colleagues from the National Immigration Law Center, but also from Josh Bernstein at the Service Employees International Union and Ben Davanzo at the Asian Pacific Islander American Health Forum, and at NILC, Victoria Ballesteros, who's their communications director. Next slide, please, Daryl. So I'm just going to plunge into the content in the interests of time. So the first start, next slide, sorry. So as you all know, we have had now 4, or sometimes described as 3.5 COVID response bills so far, with the most recent one passed by the House yesterday. And I actually haven't looked, but I think it was going to be signed today by the president. So what we have seen is some relief for immigrants, but definitely not enough. There is funding for COVID-19 testing for the uninsured, which is how many people are in fact going to get served, as well as some increased funding for community health centers. Immigrants who have Social Security numbers are eligible for the stimulus payments, which are refundable credits, and that does include DACA and TPS holders. And similarly, people who have work authorization may be eligible for unemployment insurance, and many independent contractors and others who wouldn't regularly have been eligible for unemployment insurance will be covered under the special programs for the pandemic. And some of the nutrition programs, particularly Pandemic EBT, which is a replacement for school meals when the schools are closed, and WIC are available without regard to immigration status. So those are important provisions to be aware of, but, and it's a big but. So Daryl, can I have the next slide? There are a lot of remaining gaps, and we really believe that they need to be filled, and they need to be filled at the federal level in order to reach people everywhere, and also because the federal government has far more fiscal capacity than the states and can run deficits, which states generally cannot. The bills did not lift the underlying restrictions in both Medicaid and SNAP, which means that many immigrants are excluded from them. And that's not just undocumented immigrants, it's also many green card holders if they've been in the US for less than 5 years, some DACA and TPS recipients, so it's a major issue with serious implications for access. As well as we know that because there's been a campaign to scare immigrants away from receiving benefits with the public charge rules, we know that that's likely to limit people's use of the services and benefits that families are eligible for. Next slide, Daryl. And those stimulus payments, as we noted, you have to have a Social Security number in order to access them. But also, if you are a married couple, your spouse needs to have it too. So because of that restriction, about 2 million US citizen spouses and 4.1 million citizen children in mixed immigration status families are not going to get the stimulus payments. And this is significant money. A mixed status family with 1 US citizen spouse and 2 US citizen children loses out on $1,200 for the adult, $500 for each child. That's $2,200 in cash relief. So with that, I am going to hand it to Josh, I believe, to talk about why this is really important.
Thank you so much. Hello, everybody. I really think that this is an important issue, and I think that this webinar is an important step towards trying to address the problems that exist. And I think that it's good if we step back for a second and recognize, not step back in the slides, but step away and think about what was the situation already before the pandemic hit. As you know, that African Americans and Latinx communities already had inferior access to healthcare and other types of assistance, and were already in a vulnerable situation. And the results that have come in the time since the virus, they've started collecting information about the racial and ethnic breakdown of the disease, has shown that totally unsurprisingly, the impact has been the strongest in those communities, in the African American communities, in the Latinx communities, and in low-income communities in general. If you look at the chart, this chart is already about a week old, but everything has been consistent going forward. We know that there are more cases in African American and Latino communities. There are more, as a percentage, there are more people that are hospitalized, and then, gruesomely, there are more people that are dying in these communities. So in any sane world, the response, it would be clear to everybody that what you need to do is to surge resources into these underserved communities in order to save lives, and also in order to be able to reopen, to restore our something like normal life. Obviously, if you're going to have, these particularly hard hit areas are the ones where you want to focus resources in a sane world. You can go to the next slide. Unfortunately, that's not, as was already discussed, that's not what's happening. Just to think again about the disparities that were pre-existing and that showed the need for a surge of resources. There's a higher incidence of pre-existing conditions in communities of color. The communities of color more disproportionately need to work outside of the home and are in those job categories that require working outside the home and don't have an option for telework. When they're laid off, they have fewer assets to fall back on that allow them to survive without income. And then there are fewer healthcare providers in the neighborhoods that they live in, and they're less likely to be insured. So it's kind of a perfect storm of problems that are gonna lead to the results that we saw in the previous slide. And then the restrictions in benefits that were talked about earlier have made that so much worse instead of making it better. So especially immigrants have reduced healthcare options, which means that they are going to be less likely to be tested and less likely to be treated, more likely to die at home, and more likely to go out into the community not knowing, even though they may have symptoms, not knowing that they are spreading the disease. They also have a reduced safety net, which forces them to work outside of the home. So there's a solution. The solution, as I said, is to surge resources to these communities. Doing so will save lives. Doing so will flatten the curve, which we've been hearing about for the last 6 weeks, is essential. Doing so will save the protective equipment that's needed, and it will save hospital beds because it'll catch the disease sooner, and it'll help us to trace and get out more quickly from the problems that we have and have less of a burden on hospitals. So that will also save lives. As a result, it means that we'll be able to reopen businesses sooner. And so, you know, all these things say that we should be surging resources. But another reason why it's worth it to fight for these things now is to think about the future, because really we don't want to go back to the policies and the disparities that existed before this. We actually want to begin, not only do we want to solve the immediate problem, but we want to tackle the problems that we had going in the past. And so by addressing them now, we begin to have less of a long-term disparity, which, you know, will save lives and make a better society going forward. What we want is a web of care that encompasses us all. Back to you. I think I'm supposed to turn it over to Ben. Sorry, oh, I forgot I had this slide. This is just, you know, why does SEIU fight for this so much? We are, you know, that we're a union of janitors, of healthcare providers, of people that are in the front lines. And so this is just one of our members, Anna. This is a quote from her. I continue to work to keep the building clean and sanitized so that when staff returns to work, they won't be in danger of getting the virus. You know, it's really personal to us. Every day I hear particular individual stories of people who are sitting in the front lines, who are afraid, who don't have the equipment that they need, who don't have access to the same kinds of resources that others do in order to get past this moment. So I'm going to turn it over to Ben. Thank you so much.
Thanks, Josh. So it's really important to underscore how much is at stake. Talking about the harm that's already happening and could happen in communities really underscores why we need to come together and push these asks that the Protecting Immigrant Families campaign is prioritizing. So I'm Ben Devanzo. I'm Senior Policy Analyst with the Asian Pacific Islander American Health Forum and help to co-lead the Federal Advocacy Working Group of the PIF campaign. And I'm going to first go through the 3 primary asks that the campaign is pushing, and then talk about a piece of legislation which addresses these asks and we would hope to promote. Our first ask is, given the long-time priority of PIF and the fear that is driving communities away from care, is to suspend both the Department of Homeland Security and the Department of State public charge rules. This really builds on the work of the No Federal Funding for Public Charge Act and everything that the PIF campaign members and all of our allies have been doing to push for an end of public charge. We know that it's particularly needed right now. Our second ask is focused on the overwhelming legal barriers that many immigrants face to accessing Medicaid. Elizabeth talked about this as one of the issues that exist in the legislation that's passed. Several categories, such as people who have had their green card for less than 5 years, people without documentation, and people who are here under the Compact of Free Association, cannot access the new funding that's going to states for testing through Medicaid, nor can they access the treatment or a future vaccine through Medicaid. We really want Congress to address this and ensure that Medicaid is available to everyone, regardless of immigration status and regardless of how different states approach Medicaid. Our third ask is similar, removing the barriers that Congress has created at this time for the economic support, such as the fact that stimulus payments are not available to people who file their taxes with an ITIN, and that there are many barriers to SNAP benefits for immigration population. So this is the kind of main framing we're using in terms of what we want Congress to do. It's 3 very direct and specific asks, but also we know we have a lot to do in order to make Congress make them happen. And the next slide. Thankfully, we do have legislation to direct members of Congress to when we're making those asks. The Coronavirus Immigrant Families Protection Act, which was introduced a couple of weeks ago by Senator Hirono from Hawaii and Congresswoman Chu from California, includes our core asks and more. So it does address Medicaid and would expand Medicaid access for all immigrants for testing and treatment. And it does also address the exclusion for stimulus funding for ITIN filers. It also suspends public charge so that families do not have to question whether getting tested for COVID could imperil their ability to get a green card in the future. In addition, it addresses some other key priorities. It addresses language access issues, which is a core priority for us at the Health Forum, and many immigrants face barriers to language access. There's not information getting out in a variety of languages about this crisis and how to get help. And many people are also dealing with scary language barriers when trying to get testing and treatment at hospitals who may not have sufficient interpretation services available. The bill also addresses many of the immigration enforcement issues that have been causing people to fear getting care in the face of potential deportation or ICE raids. While this isn't a core focus of PIF, many of our groups and allies have been really focusing on the pretty terrible immigration enforcement decisions that the administration is making right now. We are encouraging Congress to fully incorporate this legislation in the next COVID-19 package. So it's there, it's available for them to just easily stick in the bill. They just need to do it. The challenge is, given that many different lobbying and other groups are pushing for their issues, we really need to ensure that both our champions and those who might be resistant will push these out. So given that need, I'll actually turn it now over to Victoria to explain how we can communicate about these issues in an effective way.
Thank you, Ben. So if we can go to the next slide, I am so excited to share with you all how we're thinking about advocating for an inclusive COVID-19 response. As Josh, Ben, and Elizabeth have already shared some of the things that we are advocating for, I want to share some of the PIF messaging around how we are advocating for this, and has already been expressed. It is in all of our interests to have policy solutions that are inclusive, and here's why. These are some of the reasons why and how we're messaging around them. If nothing else, this public health crisis has demonstrated to us as a society all of our interdependence on each other. We can only be well when all of us can be well. So we are all at risk when we are setting forth policy solutions around this that leave anyone behind. Let's take a moment to recognize that immigrants are playing essential roles. Millions of immigrants are going to work every day, risking their lives so that we can be safe. They're confronting COVID-19 in the healthcare sector, in harvesting food for our tables so that we can eat every day as delivery workers and caring for our loved ones. And as such, we believe strongly that they should be included in any policy solutions that are moving forward. Next slide, please. As we think about our recovery as a nation, immigrants are going to be key drivers of that recovery. So they're not just helping us as we get through this right now. As we think about our economic and our social and our health recovery from this, immigrants are going to be key players in that. Coronavirus has demonstrated the fractures in our society, and that has become very clear. We're seeing that disproportionately communities of color are being impacted, and we need to solve that and address that in any policy solutions moving forward. And lastly, our asks, what we need to see at the federal, state, and local level for all of the reasons that we've expressed are that communities of color and immigrants must be included, must be able to access treatment, testing, care, must be able to access economic supports to get through this. We will be sharing out after this webinar more detailed, more in-depth messaging guidance, but those are really the top lines that we're using, and you'll see that woven throughout all of the PIF messaging and anything that we put forth. And with that, I will stop. Happy to answer any questions.
Okay, whoops, Elizabeth back. So our goal is to get an inclusive COVID 4.0 bill. We're still referring to the next one as 4.0. The one that passed today, people are shorthanding as COVID 3.5 because it really just primarily adds money to things that were in the previous one. Don't worry about that. But we want to get a bill that does all these good things, and we want it to be actually passed because, you know, we've got this great statement bill, the CARES version of CARES that Representative Speaker Pelosi had introduced on the House side, had a lot of the things that we asked for, but it wasn't the basis for negotiations. And so we really need to have something that becomes law. So how are we going to get there? Our targets are leadership. So the Speaker's office, the Majority Leader's office, the committee chairs and ranking members. We think these are the people who are likely to be negotiating among themselves and with the White House about what actually goes into the bill. We've got champions. We've got people like Senator Hirono and Representative Chu who have already stood up and said they support this. Over 100 members of Congress signed on to the letter that they've already written to the leadership, asking for this to be included. But it's really important that they, as Ben said, keep pushing and saying this is a priority and it needs to happen. And then moving down, the third group is what we're calling persuadables. These are the people who aren't necessarily going to push for this, but we want to make sure that they don't say, oh no, I'm opposed to it. And that includes Democrats in challenging districts who might potentially be nervous that this will hurt them politically. Moderate Republicans or vulnerable Republicans who think that opposing this could hurt them. So it goes in lots of different ways. If you have someone in mind and you want to help think about how to reach them, Kat Lundy at NILC is happy to connect you to others in your state who we're talking to about this. On the next slide. So we have created a take action tool that lets people contact their members of Congress with a click. You can share this page with your networks. It's got a nice simple ask. It sends a letter. We deliver it to the member's office. It's something that if you have grassroots networks, you can push this out to. And then, next slide. We've also made a PIF social media toolkit that lifts this up that will help send people to the Take Action page. It's a way to really try to start creating some buzz around this and trying to have people like, oh, I'm hearing from a lot of constituents about this. So looking at slides, sorry, I think that's our last slide. So we have gotten a couple of questions that have come in while we've been talking, and feel free to ask more. I will say, so one person asked about clarification on the public charge. And so what DHS, Department of Homeland Security, has said is that participation in testing treatment for COVID will not be held against people for purposes of public charge, but it does not overall suspend public charge. It says that if, because of the current crisis, you need economic supports temporarily, that will be taken into consideration, but that's sort of a complicated, nuanced message that's really hard to communicate to people, particularly after several years where they've been hearing that no, they're not allowed to access benefits. So the rule would really just suspend public charge entirely, and that's a much easier thing to message around and communicate to people. Ben, can I ask you to address the other question? Do you see it?
No, I don't see the question.
Oh, okay. So someone had asked about whether the Hirono and Chu bill also calls for the closing of interior checkpoints, and I actually don't remember the answer to that, so I'm hoping you do.
That's a good question. I don't believe it does. I believe, gosh, I will venture a guess with the, it does, and in-person ICE checks, it's a little bit different than this. And I will say I'm not a immigration policy or a immigration enforcement expert, but from what I believe, what the immigration enforcement aspects of it are, it's much more focused on actions that have been tied to in-person ICE, more of detention of certain vulnerable groups like domestic violence and sexual assault survivors, and then sensitive locations around hospitals, courthouses, et cetera, which has been a big PIF priority itself. But to my knowledge, I don't think it does, nor am I seeing that in the summary of the legislation.
Okay, I am not currently seeing any other questions. I'll leave the line open for another minute or two in case people have things that they want to jump in, but we really did want to keep this to half an hour because we know everyone is super busy. But really to ask for your support and for you to help activate your networks on this, because we're really pleased at how much attention and support this has gotten already. But as I said to someone, I don't just want the moral victory. I want to actually, as Josh talked about, how much difference it would make to the families and individuals in his union, in our communities. So we'd really like to get this across the finish line, and we can only do that if we get lots of people working together to fight for it. And yes, someone asked again, just to clarify again on public charge, that HR 6437 would suspend it entirely as opposed to just carving out healthcare for purposes of the coronavirus. Because, for example, one thing that we worry about now is if someone goes in seeking testing and maybe is found that they don't have the coronavirus, they only have pneumonia, and that gets paid for. Is that covered by DHS's exclusion? It's not super clear. So we're absolutely encouraging everyone who needs health care to get it. But we also really want a much more comprehensive suspension and eventually undoing of the public charge rule. And with that, I think we'll say have a good afternoon and a good weekend to all of you. And please don't hesitate to reach out to any of us with questions about what we've said or how you can get involved. Thank you.